What's up, guys? Welcome back to the What's True Health podcast. I'm joined by Henry, as always.
Hello, everyone.
And today we're going to be talking about just life and decisions that we have to make ending our first year at the University of Sydney. And yeah, just options, career options. We've had some talks, decisions that maybe want to explore and see what else is out there other than exercise physiology. So we're just going to talk about it, see where the conversation goes. But yeah.
Yeah, I think as we come down to the final, the end of this first year, you start to look at, it's always good to evaluate all the options and look at whether to continue doing what you're doing or whether to look at other sort of pathways we can take depending on what we want to do. And that's all about finding yourself at university and what you exactly want to do. So we have a few different things we've been talking about. It's coming down to that time. So we've been talking to as many people and reaching out to as many people as we can from different sort of units and different universities, really, and to find out more about what's going to be best for us. And so
I think we should start from the beginning. So what led us to thinking that maybe we might want to explore different options?
Well, I think it's definitely come from the podcast has helped.
Yes,
definitely, because we're sort of attuned to the whole setup of what the setup between EP and physio, and sort of we're trying to find ourselves about which is best for us and sort of whether we can combine both of them together. That's sort of what we're getting at, and how maybe one's better than the other, or whether they're better together, or so that's what's made us.
We've been asking the question, what is the difference between an EP and physio for a year now? It's coming close to a year now, and we do have a better understanding, but it's still not.
I would say our understanding has definitely
increased, our understanding, but we still don't have there's so much nuance to it, and it's just very tricky question to navigate. And even when we got Dan on the podcast, he explained it all, but then we thought we knew, but then you question yourself again, what is actually the difference? So we're thinking maybe looking into physio pathways, but in an ideal world there would be a degree where it's just physio and EP together, because
I think we've come to the realization.
I think that's what it's ultimately led up to. We realized having both those skills are
It seems a bit for some listeners it might be a bit stupid that we're just rambling on about always trying to find what the difference between EP and physio is. It's just because it's such a sort of,
it's important.
As someone who's studying it makes it a lot harder. It's very important.
It's very important.
And I think we've come to the sort of realization that universities are splitting these degrees up, sort of separating them, I guess.
Yeah.
Presenting them as a separate thing to students, and it's becoming. In the ideal world, I think they should sort of work in tandem.
I think that's what we've realized, and it's kind of led us to thinking that maybe we could look into some possible degrees further on the track. So UNSW has a new degree starting this year or last year. No, this year, starting this year. It's a triple degree. So it combines.
So they've basically, before you go into what it is, UNSW have jumped on the sort of train that they're seeing, which is, they think that there's these sort of degrees are going to sort of come together, and they think the best of both worlds can be met by studying both of these things. And I think they're the first university we know of who's created this degree. It's very, very new. But do you want to?
Okay, so it's a Bachelor of Applied Exercise Science and then a Master's of Clinical Exercise Physiology. But that's not it. That's the double degree.
Yeah, so that's one of them.
So that's one of them, the exercise science and clinical exercise physiology. That's not too different from
that happens in 4.5 years, 4.75 years.
Yeah.
Whereas the other one we're mainly interested in.
Yeah, that one, the double degree of exercise physiology, clinical exercise physiology and exercise science, is not too different from USID's one, the one that we're doing right now, Bachelor of Applied Science.
But the one that becomes sort of very interesting. Do you want to read it out?
Here we go. Bachelor of Exercise Science, Master of Physiotherapy and Exercise Physiology. Okay.
Yeah. So basically all three health science degrees in one.
Yeah.
Like
It's great.
you're not getting a bachelor in physio or a bachelor in EP though, but like you're still when someone studies a bachelor of EP or physio, that's what the start of it is sort of what you're getting at with the exercise science anyway.
Yeah. But you need the exercise science for the exercise physiology.
Yeah,
so.
exactly.
And it's 5 years.
That's 5 years. So
which is great.
Instead of the typical pathway, like the shortest pathway possible would be doing, say, an undergrad exercise science degree, which is 3 years at most universities, either UCD, UTS, and then after that, going into the postgrad physio, which is 2 years at UTS, and it's now 3 years at doctorate at UCD, so they don't offer the 2 year. So that the shortest time you can possibly do it is 5 years.
But even for UTS, right? I was looking at UTS to do Masters of Physio at UTS. You need to do all these prerequisites like I think psychology, like a neuroscience, and also one about research methods, which is like super weird. So your electives are gone basically, if you want to consider doing a postgrad in physio, and because now UCD has got rid of it, the Masters of Physio, Masters of Physio.
Yeah, they used to have a 2 year.
Now it's way more competitive, so that just puts a spanner in the works.
But yeah, so now the 5 year, you're not just getting the Bachelor of Exercise Science, you're also getting the Bachelor of Exercise Science and then a Master in Physio. You're also getting the Master in EP in the 5 years. So
that's so
valuable.
It's so valuable. You're basically guaranteed a job, and your knowledge is much more because you have more knowledge of acute and chronic. And
you get 2 streams from Medicare. That's what we talked about with one of our chats with one of our lecturers.
Yeah.
So yeah, in terms of what they study, like so this is making us make a decision on sort of where we want to go, because this has really showed something promising in terms of where we could go.
Because each degree, EP and physio, have their pros and cons. So putting it together, kind of just eliminates that.
So we can see that basically in the 5 years that you'll be studying at UNSW, you get. I don't think there's no electives. So it's all obviously because you're just
there's no time for electives. There's no time for.
So year 1 will focus on all your basic introductory stuff like anatomy, physiology, nutrition, biomechanics. Year 2 goes into straight into sort of common physio subjects as well, exercise prescription, exercise phys, more anatomy, obviously. So you're building it up. Evidence-based practice, which is really promising to see.
Yeah.
So one of the subjects is appraising and applying evidence for allied health practice, which
I wish I had.
Which is so valuable. Like we don't have anything like that, do we?
I don't think so.
That's very promising. I guess a new degree, it's showing.
Yeah.
Showing how useful it is. In your 3rd year, you'll complete integrated placement. So then you do sort of professional placements for exercise science, but at the same time, you get introduced to physiotherapy practices like
neuro, cardio,
physio.
And then you got a bit of chronic conditions in there. So that's kind of the pathology year.
Yeah, you start learning all about the
diseases,
ins and outs of. Yeah, and then year 4, you'll get more professional placement. You'll get more physio practice. Yeah, solving clinical problems, solving clinical problems.
So you basically have 2 placements, one for exercise science and one for physio.
3, I think.
3?
There's more here, yeah.
Okay.
So you get an EP as well. I think they're sort of incorporated.
So it's just lots of placements as well.
Which is great. You want that.
Right,
like you want that experience.
That's actually kind of, it's good but bad. The good being you just have so much more experience in the healthcare system.
And I think they're smaller placements because I think it's trimesters, right? So three semesters each year, so that splits it up quite well.
Yeah.
But yeah, it's in the final year you do advanced research training,
sports physiotherapy,
you do specialist physio, you do preparing for a career in health and beyond, health research project. So yeah, it looks great to me, like for face value, it looks great.
This is becoming an ad for the degree.
It is, yeah.
Like UNSW needs to sponsor us.
Well, they're doing well, convincing us that it's a good thing. Anyway,
Yeah.
but there, on the other side of the coin, where we've on like the UCID side of things, like what we can do internally, is we're looking at. We had a long chat with one of our lecturers who are sort of have a good rapport with about whether we should think about moving into physio at undergrad because they offer it at UCID or staying in EP. And I think he made some really good points. You want to talk about some of those points?
Yeah, so the thing is, UCID doesn't have that many options when it comes to physio and EP sort of things are kind of limited, but we can apply for, at the end of the year, once we get 8 units, because you need a WAM to apply for the undergraduate. So we can apply at the end of the year, and if we get in, then we'll start the undergraduate physiotherapy, but that only happens as a lot of our subjects don't actually transfer. So
about half of them do.
About half, right?
Yeah.
So it's
but
harder.
We also don't know whether any of our electives will transfer. So maybe more. But either way, like let's say we're looking at 3.5 years from then on.
Yeah.
But if say for us,
it's a longer process if we transfer.
Yeah. But in the long term, if you're just trying to be a physio,
it's worth it. It's worth it
because you're skipping the postgrad system and all that sort of stuff, and you're straight into physio. So this is the time to sort of get onto it.
Yeah, we don't have any other opportunities. I don't think I'm going to be doing a master's of physio because, first of all, it's so competitive. So many people trying to do it, and like all these electives and prerequisites. I don't know if it's worth it, to be honest. I'd rather just have the choice now and stick with it.
Yeah, and our lecturer brought up a really good sort of point about basically the main point to consider with all of this is that most people doing the postgrad, they then graduate with either an EP degree and physio, which again, like the UNSW degree, is so much more valuable than just graduating with a standard physio degree. If we move into undergrad. So you have to look at that, whether you want, so we can get into physio, which is great and it's really, really valuable, finish the undergrad, but then we don't have the exercise prescription background.
People just think physio, you're going to physio, it's better, higher on the medical hierarchy. But then you're missing that key component of how exercise can actually help people.
Yeah, like the funny thing is, right, a physio does obviously all the acute management and the hands-on stuff. And then I would say a large portion of like what they say to their patients after every sort of session is, go home, do these exercises. They show them through exercises to benefit them because obviously you can't fix an injury. Just 90% of the time you can't, touch magic wand out, touch the injury and fix it straight away. Yeah. They have to actually work to, improve the injury.
Yeah.
So a large proportion of their job is exercise prescription. And in the undergrad course at UCID, only one subject covers prescription, which I think that's a massive, just like sort of.
It's just a disservice to both the professions. Like I think, like we're at a time where it's just not easy. Like all these professions and now EP's coming into play, and there's so many pros and cons to each one. It's just confusing for a student. You know what I mean?
Yeah,
and
definitely.
I feel like we're combining it, and then you can decide later on maybe I want to focus on this specific thing. I think UNSW is just it's leading.
It's just solving all our problems of like what to choose, right? It's like what it's offering is solving our problems.
But it just depends if how that would the units would transfer and stuff like that.
Yeah, exactly.
But let's say the units don't transfer. Would you still go for it? That's a big question. Then that's 6 years.
Let's say that's another 5 years, right?
Yeah.
I don't know. We'd have to see. Like, thing is, right, the course looks so interesting. Like, it looks really, really sort of, so much sort of active placement and professional learning and, like, I don't know, it's just, if half of the subjects, I think I would really consider it if maybe half of a year was covered.
Yeah.
If like a full year was covered from our credits.
That would be it's a no-brainer. No-brainer.
You have to do it, yeah. because if we look at the first year, what they've studied, they've done basically body systems. So you guys probably won't know what this means, but like, because they don't know our subjects really.
Yeah.
But like, that's covered. That sort of, I think that's part of like the A stuff.
Yeah.
Something. Human systems, body systems, anatomy, biomechanics we've done.
Yeah. That's
Exercise
actually not too bad.
physiology we've done.
Yeah.
So like a lot of it's covered. So I don't know.
We'll see.
Sort of promising.
You've been talking to one of the unit coordinators.
Yeah.
So I think we'll find out the answer to that.
Yeah.
But yeah, it's just big
but our
decisions.
approach definitely is like, if anyone else in this situation, is definitely just reach out, talk to as many people as you can. To better your understanding and decision, talk and get sort of opportunities for all pathways. So even if one of the pathways might not be like what you're sort of leaning towards, still try get into that pathway. Just see.
Yeah,
so you have all the options on the table when it comes down to choosing.
I think what this kind of journey of doing EP and then realizing, oh, maybe I want to do something else, and just like that uncertainty, it made me realize that actually, well, the social idea that physio is just like the best. It's more medical, and EP is kind of like at the bottom. It's not actually necessarily true, and that kind of unlocked something for me. You know, they're just super different. That's something that I learned.
Yeah.
During this whole process, like EP,
super different, but they're also not very different. Like
exactly, that's the hard thing about it.
I think that you posted something on your socials about a video between comparing physio and EP, right? And that was really, I think that was a really good video. And Dan, who commented, made a good point. I'll just read that out because it was
sure,
quite
bring that up. But it's so hard because let's say we were born 20 years later, maybe these degrees wouldn't exist.
No.
And it would be like all combined.
It'll move
it's
to
just,
what
we're in it's just a bit of a uncertain time. We don't know. But I feel like there's no wrong decision. Even if we stick with EP, even after all this searching, we stick with EP, it's fine because we have, or at least I am pretty content with EP and know there's lots of possibilities there.
Yeah. If you go program structure, wait a sec. Sorry. Alright, I can't find it. Never mind. Sorry. Just
moving
on. Oh no, so this is UNSW's sort of summary of what the difference is, right?
This will be interesting.
So physios, experts in structure and movement of the human body. They use hands-on, tailored exercise, rehabilitation technologies, lifestyle modifications to people affected by injuries, musculoskeletal injuries, and neurological / cardiovascular disorders.
Okay.
Along with improving mobility and function, physiotherapists provide health education, blah, blah, blah.
Yeah.
Exercise physiologists use physical activity as a rehabilitative and preventative therapy. Exercise prescription are used to manage a wide range of conditions, including cancer, musculoskeletal, cardiovascular, so we're seeing overlap, metabolic, renal, respiratory, neurological, and mental health.
There we go. I thought they were going to say EPs don't do those, like neuro and cardiovascular.
Yeah. So if you go into who we've talked to, basically, if you, like, even with Troy, he's our lecturer who we talked to, he's into the respiratory side of research and stuff like that. If you go at the moment, the problem we're seeing here is that most of these sort of chronic conditions are being typically managed by physios.
Yeah.
Because when you go to doctors and sort of those who are actually diagnosing and prescribing who they should go and see, right? A lot of them are just going to physios, and they're saying, okay, go see this physio.
Because that's historically that's it. Whenever there's some sort of like musculoskeletal sort of thing.
So it starts from that higher
exercise exercise related stuff. You go to a physio. Everyone knows what a physio is, right? And then EPs just haven't had the time to go into society in that sort of way. You know what I mean?
Yeah. But imagine if you were a health professional and you're a physio, you can do that acute management, and then you're also an expert in prescribing. Like, that would just be ideal.
It's just the perfect bundle, I think.
It is.
And okay,
Well, it's what it should be. It's what the health professional should be
and
to me.
one thing
Like, I don't
that
know.
is really important that I think ESSA or whoever made EP missed out on is EPs. I feel like EPs should have the ability to do manual therapy, and here's why. Manual therapy, we know that it's not a long-term solution, right? Like, I can't just tell you, oh, I'm going to massage you for 2 years, right? And because you have short-term improvements, right? So, but what we can do with chronic conditions is, let's say someone has a chronic lower back pain, they've never moved before, like they're really stiff, that sort of thing. Manual therapy can actually be really useful. Maybe give them, maybe just give them a bit of a massage, show them that like the pain actually isn't there all the time. It can go away, it changes. So in that way, it can be used as pain education. But also, like maybe with that little bit of extra mobility that they got in that short time, they can start doing some exercise. I see it really valuable, and it's just a missed opportunity, I think, because so far they can only do exercise. But
again, I think it's just universities trying to separate them and make more money because more degrees, more money.
Do you think that's the reason why?
I think that's a big.
Maybe that's one.
That's
factor.
one of the. I think that's a very, that's an important factor.
It's overlooked because we've been talking a lot about APA and like physio associations trying to push down EP, but maybe unis definitely have a big impact.
You always have to. Daniel Arbilla, he brought me to that idea that you have to always consider that university is here to make money. Not just obviously educate as well, but not also a big factor is making money, and they're designing courses based off that. And so
I wish it was just more accessible. I wish we could get into EP and like a combined EP physio easier, because I tried to apply for it last year during HSC, and I realized it was 97 selection rank. It's just
it's
unreal.
Incredible.
The demand's crazy.
I don't know, but how do you grade it better to make people get in? Like, I don't like the system's a bit flawed in that way that you have to get them at like extremely high ATAR to get into these things. And for some people, they might not be ridiculously academic, but then they're great for interpersonal.
There's a limit. We've talked about this as well. Like,
you're working with patients on a daily basis. You need people who are also.
It's a people job.
Capable of working with people.
So if you set the ATAR to 99.99, and you get that like very small fraction of society which actually can get that ATAR. They're very book smart. They can write English essays very well, maybe. They know how to do extension 2 maths very well, maybe. But do they know how to talk to people in a compassionate way?
You don't just do
like
the job. You have to actually like.
But then some people might argue. Some people might argue that that's just what you learned that along the way. But then it just comes to the whole like, what's the validity of HSC and stuff? Is it a very valid way? That's a different conversation. But
definitely in terms of because obviously later I'm having a conversation with the head of the like degree for the UNSW degree, just to find out more. And I definitely want to know whether you graduate with say the same qualities and the same opportunities as if accreditation.
You do.
You reckon?
You what? Well,
I don't know. Like
you'd be an.
It just seems too good to be true. Like I don't know.
Accredited exercise physiologist and accredited physiotherapist. That's your degree. But there's also there might be some cons as well.
Definitely.
How is CPD going to work? Like continued professional development, because we know for EPs they do like courses and stuff like that. Same with physios, they do courses, and you get points, I think, as well. And you have to meet certain number of points every year to continue your professional development.
You mean once you get out of university, right?
Once you get out of university, right? How's that going to work? Because you have to do both. Because that's double money for with the courses and stuff, right?
I don't know. I think that comes down to what you sort of go into. I think there's definitely.
But if you want to hold those accreditations, you have to meet those requirements. So I don't know how that's going to work.
But maybe this is what I think there'll be. There'll probably be professional development areas and topics which overlap and have the same.
That would be an ideal
EPs
situation.
And physios do them. Right?
That'd be an ideal situation.
Yeah. Does it? Yeah. That's a really really good point. Does that mean you have to do double the amount of professional development? If anyone knows, let us know.
Yeah.
Any EPs, because you guys probably know more than.
And also, another thing is like costs. So obviously, you have to pay money to get when you finish your EP degree. You have to pay ESSA money to get the accreditation.
Yeah.
Like, I don't know. I think it's a couple thousand or something, maybe,
Yeah.
or like 1,000 or something.
Mm.
And then same with, I'm assuming it's the same for physio. You have to pay money to get the degree, but then you have to renew memberships and stuff like that, right? So it's like
That's such a scam.
it's like extra costs that maybe, yeah, I don't know, because you do get more job opportunities and more money, but then there's also that hidden cost. So it's, you have to weigh up the options. Is it worth it? So I'm not sure.
You're gonna be making enough to cover this stuff.
You reckon? Yeah,
I think so.
Yeah,
like hopefully.
yeah, but yeah, it's not all positives. There's also some, well, not negatives, but uncertainties. Just because it's new.
Yeah.
Yeah.
I think in terms of like the overall employability, definitely will increase if
Well,
you have
just
both.
just the logic. You have 2 degrees. You're gonna get more employability.
Yeah.
But does that mean you're not gonna get employed as an EP or a physio separately? No.
No, I don't.
But it's just I guess having that together just makes it better. But
So
I
yeah.
think at the end of the day, even if we don't get into anything, whatever we apply, nothing happens, or so we find out that we can't even do it anyway, I think we're in a good place anyway with UCID
Yeah,
EP.
like the grass is always greener, so you have to always think that
Yeah,
where you are is also good enough.
yeah, and everything happens for a reason.
Yep.
So yeah, it's quite, but it's just so interesting. Like like I said, if we were,
I just want to know where we end up. It'd be funny.
I know, but if we were born 20 years earlier,
I
or
think
20
we're
years
right.
after,
We're right in like the
grey zone.
the grey zone.
Yeah.
As it's like the transfer.
20
zone,
years
like
ago, we would have been, EPs wouldn't have existed, and we would have been like, okay, physio, actually no, the ATAR was lower in the past, so we probably would have got into physio and just been physios. Yeah, okay, we're physios. 20 years later, maybe there's a combined degree and everyone can get into that. But now we're in that middle zone.
I think we'll start seeing for those physios who don't, if undergrad physio really picks up, and I think it is, I think we'll start seeing a lot more sort of postgrad EP stuff. Do you reckon?
Okay, well, what do you mean by that?
So physios, like just undergrad physios, sort of graduating, and then realizing they're sort of disadvantaged in where they can work because of their lack of exercise prescription experience.
Okay.
In terms of working clinically with like chronic disease and stuff like that, I think there'll be a increase in sort of popularity.
That'd be good
for postgrad EP.
But then you might as well just combine it at that point.
It's just so stupid.
But then for the universities, double money.
Man, more money. Come on.
That's a big factor.
Yeah. Always is.
Correct.
Anyway, if anyone has stayed and listened to this whole thing, us ramble on, and you have any suggestions or like advice on what we've sort of brought up in the different pathways, etc., or if you just want to ask more questions,
let us know.
You know all the socials, just
Or if you're a student and you have no clue what we're saying and you're trying to figure out how to even get into these degrees in the first place, message us. We'll try and help.
Yeah, we're happy to help
as much as we can.
And we're happy to get some advice as well. So
yeah, hopefully we look back on. Imagine when we look back on this podcast.
This would be sick. I look back in ages, like a couple
10
of years.
Well, not 10 years, 5 years, 6 years, and it would just
be like, damn, that's what we were. That's what we were going through.
That's what we were thinking.
That's how our pathway got chosen.
Yeah,
it all comes down to this.
Damn.
Yeah.
I guess we'll have to do a reaction to this in a couple of years.
Yeah, it'll be good. All right.
But yeah, so do you want to end it there?
Yeah, thanks for listening, everyone, and keep an eye out on the socials. There's more episodes coming out.
For sure.
So be sure to leave comments, and thanks for listening.
Thanks, guys.
Bye-bye.